Thanks everyone for joining today's call. I'm Chris Shepard, IRC member and founder of Southern Smoke Foundation and OS Benefits board member. We're here to discuss how to offer affordable healthcare and wellness benefits to your team, a crucial step for building supportive and sustainable restaurant work. Gotta have it. It's one of the most important things that we can do for our teams. So thank you for joining this call. I'd like to introduce co-host Jody McAllister, Director of Human Resources at Frasca Hospitality Group. Hi, Jody.
Hello, everyone. Thank you all so much for having me today. I'm super excited to be here as well. As Chris mentioned, Director of Human Resources at Frasca Hospitality Group. I've been with the company for 12 years. I've been in this role for 6 years. And so I've seen the company grow from 2 restaurants to 6 restaurants. And over that time, I've been responsible for navigating the very confusing world of healthcare for our employees. So, I myself am looking forward to learning more and also addressing, some of the most common questions we get from our team members. With that, I'd like to introduce Elizabeth Tilton, founder of OS Benefits. Welcome, Elizabeth.
Thank you, Jody, and great to see you again, Chris. Happy to be here. Happy Wednesday, everyone. Yeah, I'm Elizabeth. I'm, again, the founder and CEO of OS Benefits and also have a consulting company called Oyster Sunday. And OS Benefits is really a direct kind of spawned out of Oyster Sunday, what we're hearing there. But, we're really dedicated to bringing health insurance plans and wellness benefits to the hospitality industry through our new OS Benefits. So we'll dive more into the details of that. But I'm based here in New Orleans, Louisiana. I see Kathleen on the call, who's also down in New Orleans. So great to see you, Kathleen. And we can, dive on in.
All right. So could you give us just a quick overview of OS Benefits and how you approach health insurance is specifically designed for the hospitality industry?
Yeah, totally. So what we did was we started researching this back in 2019, trying to figure out if with Oyster Sunday, could we bring on our restaurant partners that we're consulting with onto our healthcare plan, and needless to say that was not possible. So we spent about 3.5 years ticking away at saying, okay, what could we do? So what we've done is that we have created a company, an association where employers can become members of the association. And as a result, they unlock our 4 ACA-compliant healthcare plans and over 25 wellness benefits, most of which are free or reduced rate for their employees. So we kind of surveyed the landscape and said, okay, what are the really core things that our teams need? We'll diving into the health insurance side, is that through the association, we were able to bind these shelf-stable, nationwide, low premium, low deductible, low copay health insurance plans that really met the need of our individuals. And I'm sure anyone on this call who's in HR is constantly battling the access to health insurance through small business, because you have this really big cycle where you have the employer goes to find insurance. They get a plan that's high premium, high deductible. They have low participation in their employee set. And they can't really I'm looking at Jody nodding right now. You can't really make a dent enough to make the premium accessible. You get low participation, and those who are probably most in need are signing up. You get audited the next year and your premiums go up. And there's this vicious cycle of anyone under pretty much 100 full-time equivalents is probably the break point of that costing. So what we sat there and said, okay, well, if that's the case, and most of us are under 50 full-time equivalents in our brick and mortars, then why can't we figure out a different solution? So that's what we went out to solve. And to kind of put a quick stat to that, Chris, is that only 34% of hospitality workers are offered employer-sponsored healthcare. And in the private sector, it's more like 85%. So we have a huge, huge gap, leaving a lot of our teams very vulnerable.
Elizabeth, this is amazing. Thank you. That sounds so promising. What are some of the core benefits included in OS in your health plans? Do you include vision? Do you include dental benefits?
Yeah, absolutely. So we have 4 plans, one of which is an EPO. So we call it our essential plan. So it's really meant to be primary care. We have free unlimited telehealth for all plans, which we thought was very valuable for our particular demographic. And essential plan has something we call hospital indemnity, which is more reimbursement. But as you get to the PPOs, we have, you can have a child, you have prescriptions, both generic and name brand. We really sat there and said, what are all the elements that we need on these plans? And then we do have voluntary benefits. So everyone can sign up for vision or dental, regardless if they chose medical.
Amazing. You mentioned two things. Can you talk a little bit about PPO and EPO, the difference between the two? Can you mix and match them? Like when as an owner or HR, how should you decide between a PPO and an EPO? Can you give us some details on that?
Yeah, totally. So I know there's a lot of HR professionals on this call. So this is something that I've been able to learn over the last 3.5 years. I know you're spending your career in that. So it's something I've learned, like the learning curve of this topic in general is unbelievable. So I want to acknowledge that as anyone listening to this call, particularly as operators navigating this space, it's a lot. But in terms of how we distinguish between our plans, our EPO, which is our essential plan, which stands for an exclusive provider organization, a PPO, which stands for preferred provider organization, it kind of comes down to what we distill down to two elements. One is, what is your network coverage? How big is it? How expansive is it? And then what are your benefits coverage, like in and out of that network? So those are the two things that when we think about those definitions, kind of delineate how to understand them. Our EPO, which is as in its name with the word exclusive, means it's more limited. So as a result, the premium tends to be, your access is a little bit more limited, is more limited. I shouldn't say is more limited. And as a result, your premium is more accessible. So anyone who maybe has no chronic conditions, maybe has more of an appetite for risk, maybe wants to see their primary care physician every year, that plan starts at $239 a month and is unbelievably accessible, because what we're really learning is that a lot of these plans are starting in the 400s, 500s. So it's much more accessible. In between an EPO and a PPO is an HMO, which we do not offer those plans. But if we go into the PPO, which is the preferred provider organization, these are looking, this is where we're getting into much more in and out of networks, much larger networks. And so they're much more comprehensive. And that's when it gets down to the details of which PPO plan do you want. But Jody, to answer your question around accessibility, if you have one employee, so you're an owner and one employee, you can buy into the EPO plan immediately. And then if you have for the PPO plans that are more comprehensive, all you need is 5 participants. So for us, another element we were seeing all the time when it came to participation requirements and small business insurance is that they were so inaccessible, right? We're talking 18% of your team might opt into healthcare. So we said, okay, what happens if the participation was lower too? So we made all of our plans, because we have this association, the barrier to entry for participation is much lower, and as a result, able to kind of cap the cost of the premiums.
So I know, how does the OS benefits compare to other options in terms of like affordability coverage? I know Jody asked about vision and dental, but one of the things that is and needs to be addressed in a larger format, in a larger way, are access to mental health care services through the PPO, or is it a standalone marketplace? I trying to piece these things together where it's, you've got the EPO, the PPO, vision, dental. Is mental health care accessible in there as well?
Yeah, definitely. We have free behavioral health in that, but also we have these two worlds. I guess let me back up a second. Okay. With OS benefits, we have 2 offerings. We have the health insurance and we have our wellness benefits. So what we basically planned on doing, how it's built, is that as an owner operator, you join the association per head, right? So it's we cap it band saying all right, 0 to 10 people, 10 to 20, 20 to 30. You pay an annual fee that's very nominal. It starts at $65 a month. You join us in, and then as a result, you unlock this whole world. And we have a technology that's built to have the dashboard that houses your insurance plans and your wellness benefits. So that's that's what we're offering you. And then as you get into the back end, we have those 2 worlds where you can say, okay, my employee set does want health insurance. We're going to come through the Association for Health Insurance. Then your team gets the options to pick, right? So you choose as the employer, I want to get the EPO plan, I want to get this PPO plan. and I'm going to contribute $200 to every employee who joins. The employee then chooses that, and it comes out of their deducted out of their payroll, which we're integrated into. Like normal, if you've ever done benefits administration, that's how that's working. And then on the other side is that there's going to be this whole population of people who don't participate in healthcare. Maybe they're on their partner's plan, maybe they're at their parents' plan. There's going to be this cohort. But as joining the association, this whole world of 25, what we call like fringe benefits or untraditional benefits, are accessible to that entire population, which includes things like Southern Smoke and Behind You. So we have this world, so we have this world where you can get, if you have healthcare, you can go get free telehealth, mental health services, or if you're uninsured and or you prefer Behind You with the counselor you have, that is still accessible and free to you. So that's the thing that was really unique about this plan. It's not just saying, hi, we're a broker, here's United Healthcare's plans, go forth and conquer, and then you're on your own. Rather, what we sat there and said, we bound these 4 plans that are bound to our association uniquely. And then as a result, you join and you get access to these plans, and you join us, and you have this whole world of benefits administration that we're constantly improving and building towards. So I think that's a really big distinction. And I'm glad you brought it up, Chris, because even just looking at mental health as the example, right? Like you can get it through your healthcare, or we have crisis text lines, we have the emergency relief funds that you also have on Southern Smoke, and the Behind You, all those are embedded into our platform, and it's unique to every state. So if you, let's say right now Behind You is not available in the state of Iowa, anyone in Iowa will not be displayed that. So they're only seeing what they actually have access to. In the state of Louisiana, we would see it. State of Texas, we would see it. So that's how we built the technology out to be unique. And the last piece I'll say is that if you already have coverage, let's say you have coverage through Blue Cross Blue Shield, United Healthcare, that's great too. We can embed that into your dashboard. You can still join the association, get all the benefits, these 25 fringe benefits as part of that to every member of your team, and we'll embed your 401k, your United Healthcare plan, whatever that may be, into one area. So you can have one location where all your employees know exactly where to go. And I think that's really crucial solving for that, because otherwise we're out there looking all the time on URLs and bookmarks and or your HR departments, like I look at Jody, are trying to help you navigate that.
Do you have any tips for, what's the process here? What as like a business owner do I need to do to enroll into OS benefits? Do I need to have a certain amount of employees opt in? Do you need a certain number to participate? Do you have enrollment periods, Jan 1 or is it October 1? What are some of the details in that process for you all?
Yeah. So you could have as little as 1 employee and join us.
Amazing.
Right. And that way they would be able to join. If you're looking for health insurance, they'd be able to join our essential plan. It's at 5 people, we're able to join our PPO plans. So that is a very big distinction and important to note. But in terms of just, if you wanted to come to the association, be part of this, that it can be as little as 1 employee. And we're able to service hundreds. So and we are right now working on a group where let's say you have a restaurant group, like at Fresca, and then you have multiple locations. We're right now working on a super admin to oversee multiple locations as well. So all that functions coming into it. But in terms of joining, what would happen is step 1 is joining the association. You become a member, you join all your entire team. That process is you onboard through the association, you understand what that means for you, what the agreement is. And then the next phase is that we just ask for your employees set some very basic information to get them onboarded, and then enrollment is done. And then we take it from there. So it's a pretty quick process. We made it very quick. I would say going back to whether or not when's the open enrollment period, if you're new to us, it's rolling. Any month, any day, you can come on in. We enroll the first of the month. We usually say it takes like 45 days to 60 to answer any questions, to get all the information you need, to make sure you feel very confident knowing what you're getting. And usually that's a good window, because if you have health insurance, let's say I'm with Blue Cross Blue Shield, Humana, whomever it may be, I'm given 60-day notice from them to evaluate my plan for the next year. So we know that's kind of a sweet spot. So let's say my plan begins February 1, I re-enroll in Humana. From right now, I have 60 days to decide what plan's best for me and my team. So we'll run through all those analytics. We'll run through all that data from you, analyze side by side. We have brokers of record that are really helpful, that are third parties that are not employees of OS Benefits, that I think is important because they're able to really kind of help you navigate these plans and what it means. And then that's the process. We onboard you, and then you get your health benefit cards and dashboard access.
Man, this is amazing. It really is. And there's so many things out there. And what you're doing is kind of just bringing it all together, which makes a whole lot of sense. So, I mean, what I've seen over the past year, like when you start talking about insurance and coverage and things like that, it's one of those things that's super hard to really narrow down to and read into, especially when you start talking about, as a small business owner, trying to figure out what's best for your staff. What should restaurateurs and restaurant owners, what should they consider when choosing a health plan provider? And like whether it's OS Benefits or another provider, what should people be looking for? Because I think when you saw, you know, all of the storms come through this year, one would just like restaurant insurance, things they thought were covered were not. So what with healthcare should they be looking for that's to help them at the best point?
It's such a good question. I would say, and no matter what plan you go for, there's always costs, there's pros and cons, right? If it's a high deductible, it's a whole lot out of pocket. So you have to have a lot of cash reserves, right? Or if it's a high premium, you're paying a lot up front, probably because you need it most, and you're having maybe, let's say, a chronic condition or something else is justifying that cost because the insurance carrier knows that you are going to utilize that the most, right? So there's always, you have to think about it as these pendulum swings of access. I think that when it comes to teams, regardless, you know, and I kind of put in two camps. One is, I would say 90% of our teams, this is an assumption, what they're most concerned about is, can I go see my primary care physician? Do I have access to urgent care? Do I have access to telehealth and mental health, right? Those are probably a big cohort, let's say 80%, a big cohort. There is a population that has chronic conditions. They're managing chronic conditions, and we're really upfront about our plans have gaps in that we're working on covering, right? So if you have something like you need cancer treatment for any reason, you have something that you have a lot of vulnerability, we're really clear of saying, okay, if you have these chronic conditions, you really should consider, if you have unique prescription requirements, you have unique hospitalization requirements, then you should look for plans for that. But I think as we talk about for the majority of our teams, is that there can be an opportunity for you to offer healthcare and still offer them access, right? Where they can go to maybe that person needs to go to the ACA and find the care that's best, and it can be subsidized. So I just want to say that because that's one thing we're here to tell you exactly what's on our plans. But what also our mission is to constantly improve. And at the end of the day, medicine and medical it's individual, right? What you're doing as an employer is you're offering them an opportunity to opt in to the best of your ability to cover them, right? And maybe the best choice for you is to only do reimbursement or to only go to X, Y, and Z carrier in this one state as an HMO with very limited coverage, and they have to be referred. Like, these are choices you have to make as an employer. But I think for us, we were trying to sit there and say, okay, how do we first solve for 90% of our teams? And let's start ticking away at the last 10% to cover them. But we know that right now, if we have 9 million people uninsured in our industry, that needs to be solved for. And because medical debt, you know, not having any coverage, the amount of times we see GoFundMe's on our accounts, right? Like, we don't want to, I think that that's something that we need to stop. And same with what, again, like I keep bringing up Southern Smoke, but the same thing that y'all are doing with mental health. Like, we can't have another person, you know, make very harmful decisions on themselves, or to step out of the industry because they don't see a path forward, because we need to create something that's different. So that's what we're going out to do. And our first step is these plans, this access, which we're really proud of, and we know that we're going to continue to improve it. I hope that answers your question. I kind of went around, but I would say the most important part is that you should look at what they call SBCs, right? Side by side, look at your coverage, ask your team what they need. And there may be outliers, and that's okay. But I think the most important part is saying, how do I take care of, you know, as many people as I possibly can with the coverage I'm given, because there's always give and take.
I think what you're doing is fantastic by bringing it all together and giving it one spot where I can take a look at it and give these benefits, these opportunities to our staff that they normally would not know about or have. So thank you.
Yeah.
Yeah.
And I think too,
Oh, go
oh,
ahead.
I'm sorry. Go ahead, please.
No, go ahead. You guys finish that part.
I was just going to mention that, one thing that's proof to us that there's definitely great traction is that right now, we've been seeing a lot of employers that are coming to us looking for different coverage. They're seeing a 15 to 20% increase in their premiums right now across the country. And I'm sure maybe many on this call have experienced that, and that's like shocking. But additionally, when those who are enrolling in our plans, we're seeing an enormous increase. So I mentioned earlier, it's kind of like that 15 to 18% participation, depending on what contribution the employer is making. But we're right now seeing a 40% participation rate on our plans. Like, to me, that means it's accessible. That means that the barrier of entry is lower. And that to me is success, because that means we've just added in 20% more people into healthcare per team that have enrolled. And that to me is like, all right, we're on to something, right?
Yeah, that's a huge win. That's incredible. I think a lot of that comes from the more communication, the more education that you can provide, as a OS providing that to restaurant owners, this is incredible. As restaurant owners, as HR professionals, the more information that we can distill to our teams so that they can pick up on it, the better our populations are, the better that our employees are. I think we've found the more success we have with participation and enrollments, it comes down to the 2 to 3 months prior to that and educating our teams on the plans that we have. It's doing the surveys to see, what kind of plans, what kind of pricing, what kind of options do our employees need. And then taking that to those GMs, those chefs, so that they have that information in their pockets when they're talking about hiring people, when we're trying to get great talent. Having these benefits can be such tools for not only talent and hiring, but also those retention tools. So, I can't stress enough as owners, as HR professionals, really just making sure you're getting that information, doing the work on the back end, but then getting that information to your team so that they then feel comfortable communicating that and bringing that to their employees. So less confusion, open communication, all of that will really help kind of promote that company culture that we all want. So
yeah, I agree with that, Jody. And just to touch on that real quickly is, one thing that we hold, at the end of the day, our benefits marketplace is meant to aggregate the top of the top that we see as nationwide access to childcare, dog walking, mental health, physical wellness. And what our responsibility at OS Benefits is to educate. And I think to that point, we have, and we're really lucky that on our consulting side, Oyster Sunday, we've been around for 5 years and have helped hundreds of restaurants coast to coast. And we, at our core over there, we have a really great strength in digital marketing. So part of our responsibility is like, we can take that knowledge and think about customer journeys, think about how are we educating our team? How are we getting them the right information? Is it digestible? And making that part of this onboarding experience where you start and you have, weeks of information coming your way. And that's our responsibility and I think that's a little bit unique. Most times you join healthcare and they're like, see you in a year, and I don't think that's fair. And because there's so much opportunity that people can have access to, and understanding the implications of going to the ER or urgent care or virtual telehealth, right? Like, these things need to be discussed, and because there's monetary differences in all those decision makings. That's stuff that we're really driving home, particularly going into next year, building out more and more and more. But education is so crucial, and it's such a barrier of entry. Like, it took us years to learn the difference of coinsurance, copays, deductibles, like all of these things that people take for granted as the jargon of health insurance. And it's getting more striated, right? And it's getting more complex and more layered. And then you have to then translate that to your team. And that's just an enormous, but if you distill down saying what matters most to you, you say, all right, the least out of pocket, the most coverage, in and out of network, access to X, Y, and Z, then you're like, okay, I think this plan's good for you, right? That to me is where we owe them.
Such incredible insights. Thank you so much for bringing this to us and answering some really important questions. Is there anything else that we didn't touch on, or that, you want to add on to?
Yeah, I mean, I would say in general, I think I get asked a lot about what's the difference between what OS Benefits is offering and if I were to go out and get my own care. And I think that the most important thing to remember is that having built a collective and an association, which is something I think the IRC does so great, is you're representing a lot of people, right? You're representing the behaviors and the best interests and advocating on behalf of many. So I think that one thing to note is that by joining the association, it's obviously you have access to these benefits, but as we continue to grow, we're going to be able to centralize information. We're going to be able to centralize data about usage and what people are actually asking for, feedback loops, right? So you're being part of a bigger community. And I always joke, having been in this industry on all sides, back of house, front of house, corporate, that we're a band of pirates out in the Atlantic, and we all want to find each other, right? Like everyone wants to learn from each other. And I think organizations like the IRC have made that possible even more and more and more over the course of the last couple of years, advocating on our behalf. But our responsibility is to sit there and say, we're listening and we're going to continue to improve. So being part of this is not just about getting healthcare coverage. It's about participating in something that's much bigger, because maybe we have these plans now, and then in the state of Louisiana, we decide to go direct to hospital networks, or we decide to move over to a different carrier and expand coverage. Like, that's our responsibility. And being part of this is going to be where the future lies, right? Because we're going to be able to do it knowing what people need the most and taking on that responsibility and building towards something that's easier to use, more accessible. That's my goal, right? And I think, I was actually pre-med before going to go cook, want to be a pediatric oncologist. And I think there's an enormous community of people in the hospital networks and in medicine that want to care for this community, and we're going out to go find them. So I'll leave it with that, because I think that's really important.
Elizabeth, I'm going to jump in here for a second. We have a couple questions in the chat I'm hoping you can answer. Just some clarifying questions. One says, thank you so much for educating, Elizabeth. Are these plans fully insured or self-insured? And the second question, are you also able to help with filing 1094 and 1095s?
So they are level funded. So they're in between a self-insured and a plan. So that is a very important distinction. And happy to talk about what that means. It basically allows us to create some restrictions around coverage to make it approachable. And I will get back to you about the filings. But yes, we have those all like systemized, but I don't want to misspeak about how that's being produced, but let me get back to you on that. Thank you.
Thanks for answering those. That's all we have in the chat. Chris, back to you.
All right. Well, you know what? Thank you, Elizabeth. Thank you for making this possible. Thank you for all your work you're doing at OS Benefits, and really giving people that are in the food and beverage industry and restaurants the opportunity to be able to have access to these things. It's very special. It's very, very special. Thank you to the IRC for facilitating, and thanks to all the participants for joining today. Thanks for spending your time this morning with us. Visit the blog spot. Look at that. She just put it up there. Let's keep working together, support our teams in every way possible. It's how we do it, right? It's how we get through the days every day. It's looking, when you walk in, you see your team. You're responsible for them. Let's take care of each other. Stay safe. Wishing all of you a healthy and happy holiday season, all right? And until the next time we're on one of these calls, love you. Thank you very much for being here. Really.
Thank you.
Thank you, Chris.